Good afternoon, everyone. My name is Björn Gerlach, and I am honored to be your host today for this webinar series of the 3R Network Baden-Württemberg. I came to this honor because the usual host, Silke Keller, is just flying back from Canada from a conference, and the backup host, Markus Meinhardt, is going to a conference. We will first have the presentation by Dr. Daniel Segelke, who will talk about objective recognition of harm, including pain, suffering, and distress in experimental animals, dream or reality. So I'm very curious how we will answer that question, how he will answer that question, and maybe there will also be a lively discussion afterwards. So before we start, let me briefly introduce our speaker. Daniel has earned his doctorate in Bochum, the radiologist, now affiliated with the Clinic for Anesthesiology in Münster since 2013. Sorry. His work is primarily focusing on acute, chronic, and post-operative pain in preclinical model systems and clinical spheres. His work offers significant insights into medical care. He's also dedicated to 3R principles, emphasizing pain assessment in rodents, prospective strain score development, and systematic reviews. As chair of the Animal Welfare Commission and Animal Welfare Officer, he champions ethical research standards. And his research on 3Rs is funded by the BMBF and the PV Solas. With that brief introduction, Daniel, I give the floor to you. Please share your screen, and we are very much looking forward to your presentation.
I'm very pleased to hear and give you a talk about the objective recognition of harm, including pain, suffering, and distress in experimental animals. And the question is it dream or reality? And I can answer this question at the beginning of this presentation. It's not, at the moment, it's a dream. Why is a dream? And we can reach the reality with some methods from the human care science. First, we need some definitions of animal welfare, the well-being, answering animals' experience, good health, and a positive state of being. The animals have basic needs, providing proper housing, nutrition, and disease prevention. We as researcher or animal or veterinarians, care professionals, we have ethical responsibility to answering animals under human care and treated with compassion. We make minimization of animals or minimization of handling, actively reducing any unnecessary suffering or stress. And animal welfare is a holistic approach, considering both the physical and psychological needs of the animal. And in the biomedical research, animal welfare is implanted, for example, with different concepts and principles. The 3R principle is the most important principle with the reduction, refinement, and replacement. And today we talk about refinement instruments, refinement methods. We also implemented ethical considerations, ensuring human treatment of animals, recognize their sentience. We have research validity in animal welfare. The good animal welfare often correlates with more reliable and reproducible results, as stress or poorly treated animals can introduce variability of our study findings. Other points from animal welfare in biomedical research is the oversight and regulation. Many countries have regulation committees and review boards in place to oversee animal use and ensure welfare standards. And this is one of the reasons we are here today. Is a continuous training of researchers, handlers, healthcare professionals in context of animals are trained to provide proper care, recognize signs of distress, and employ best practice in their work. And prioritizing animal welfare in biomedical research not only aligns with the ethical imperatives, but also enhance, and this is from my side as a researcher, a very important point, the quality and reliability of scientific outcomes. We have some problems to measure the quality of life in animals, and we have a problem with the objective evaluation of the quality of life in animals. And in human and veterinary healthcare, quality of life is a comprehensive concept that encapsulates or including physical, mental, and social well-being. Quality of life is deeply entrenched in human research. We have many tons of paper here to research quality of life, but the exploration of quality of life in animals remains relatively new. And the question is, what does quality of life mean for an animal? I think it's a very general question. And how do we quantify and measure the quality of life in a very accurate way? And I think this is a very important question today. And these questions are not just academic, they have profound ethical implications, for example, to treat animals in the human way, to decide has the animal reached the human endpoint in a biomedical experiment, and so on and so on. And the challenges in development or in the observation, in the outcome observation of animals, the outcome here is the quality of life, is that we have a problem with animals as a patient. We need an observer, an indirect here on the right side, the indirect perspective to see an outcome. And from the human healthcare development, the gold standard for physicians or for healthcare professionals is the direct input from the patient called patient-reported outcome. The patient can direct talk about well-being and so to a physician or healthcare professionals. Then in the observer reported outcome, or in context of animals, we have also owner for dogs and cats, owner reported outcome. We have an indirect approach to report about outcomes. Patient-reported outcomes are often gathered through questionnaires or interviews that ask the patient directly to report on various aspects of their well-being, and this leads to a direct understanding of patients' health status from their own perspectives. In contrast, the observer-reported outcomes, OBS-ROS, or clinician-reported outcomes, CRIN-ROS, are assessment made by healthcare professionals, caregivers, or other trained observers. These outcomes provide a more objective measure of the patient's health. The problem with the patient-reported outcome, we have a part, or we have a part of subject information, and we have with the OBS-ROS, we have based on standardized observation methods and clinical tests. But these points are established in human healthcare, but at the moment not in animal healthcare. And these measures can include observable physical symptoms, functional assessment, and clinician-rated mental status evaluation. And OBS-ROS and CLIN-ROS are particularly available in cases where the patients might not be able to self-report, such as in conditions involving cognitive impairment in pediatric care, for example, or for animals here in this situation. And the problem is we need observer reported outcomes, but at the moment we have no good measurement instrument to measure the obstro, for example, pain status of the animals. And over the past decade, there has been a general increase in healthcare initiatives and methodologies that have focused on indexing various categories of reported outcomes and associated measurement tools. And such efforts for animals or an animal welfare science have been very sporadic and methodology poorly structured. And reported outcome measures can help researchers, veterinarians, animal owners, or animal care staff to identify welfare problems in the early way, track changes over time, evaluate the impact of interventions, and ensure compliance with welfare standards and regulations. And given that animals cannot verbalize their feelings and state, we cannot use here an interview situation, the challenge of accurately assessing their quality of life is paramount, and any inconsistencies or inaccuracies in measurement of the quality of life or subdomains of quality of life, for example, pain, can significantly impact our understanding and subsequent intervention or care. And the development of measurement instruments, we have here a big knowledge lack. Is still a lack of behavioral measurements that enable the encompassing detection of quality of life, as few established reported outcome measures can record these correlates objectively, simply, and non-invasively in everyday work. One example, and I will give you some detailed information about this, is, for example, the Grimm scale. When studying animal behavior, it is critical that the measurement instruments or scale used from healthcare professionals or researcher be reliable, valid, and able to accurately capture the nuances of behavior patterns. And one way to reach a better measurement instruments for observer-reported outcomes could be integration of different or of methodology from human health science. And one methodology is the COSMIN methodology. COSMIN is an acronym for consensus-based standards for the selection of health measurement instruments. And COSMIN is developed in the human health outcome measures. The fundamental premise revolves around ensuring the reliability and validity of measurement instruments in context of patient-reported outcomes, OPS-ROS, CLIN-ROS. We see here the different domains of this COSMIN methodology. This methodology offers a standardized criteria for appraising the methodology quality of studies in context, for example, of systematic reviews, and the reliability and validity of these instruments in these studies or for the development of novel studies. This methodology includes very different psychometric properties, and this year's the different psychometric properties. We have three huge categories: the reliability, responsiveness, and validity with the subdomain, the construct validity. And I give you some examples for different points here in context of animal welfare. We start with the content validity in animal welfare measurements. The content validity evaluates the degree to which the content of a test, for example, quality of life or pain or stress or anxiety, reflects the intended measurement concept. It ensures that the test items in the measurement instrument comprehensively and representatively sample the domain of interest. And it is very crucial to ensure that the measures employed provide a comprehensive and accurate reflection of the multifaceted nature of animal welfare. But I think this is a very, very, very huge challenge for us to capture this point. And the focusing solely on physical health indicators without considering behavioral or psychological factors would give an incomplete view of an animal's overall well-being. The second point, psychometric factor, is the intercultural validity. I rephrase this term into interspecies, and in some cases in interstrain, and in some special cases we have also intergenetic modified animals. The interspecies validity in animal welfare measurements, and this interspecies validity ensures that the content of a test is relevant and has the same meaning across different species, different subtypes, different strains, or, for example, for different genetic different animals. It's essential for the tests used in multi-species setting to ensure they aren't biased toward a particular group, and each animal species possesses distinct physiological, behavioral, or ecological characteristics that can influence their own well-being. For example, mice needs other basic needs than, for example, a naked mule or so, or we need other needs than a mice. One good point here is the eco-niche of the different species. What may be a clear sign of distress, for example, in one species, might be a normal behavior in the other species. And while certain fundamental principles of welfare may be universally applicable, the nuanced indicators of well-being can vary widely between species, but also in different ages, sex, or different strains. And researchers and animal care professionals must ensure that the tools they use to access welfare are not only scientifically sound, but also tailored to the unique needs and characteristics of the species, sex, and age group in question, or strain and other factors. The next one in the Cosmin methodology is the reliability in animal welfare measurements. The reliability refers to the consistency and stability of scores across different administrations of a test. A reliability test should yield similar scores for an individual if they take the test multiple times under consistent condition. I think it's a very important point, for example, in animal facilities, to assess the well-being very rapidly by different persons. When assessing animal welfare, consistent and replicable results are essential to make informed decisions and drive meaningful improvements. And inconsistent measurements can arise from various sources, for example, including the subjective bias of observers, because we have no or very poor measurement option, difference in the interpretation of indicators or behavioral pattern, or even the use of inadequate tools or methods. Measurement instruments is one example here. And therefore, researchers and professional healthcare in this field must place a strong emphasis on standardizing methodologies. For me, one important point is training the observers and validating tools to ensure consistent and reliable results in animal welfare. The next one is the internal consistency in the context of animal welfare. The internal consistency assesses the degree to which items in a test are interrelated or provide consistent scores. It's a measure of the extent to which all the item scores on a test measure the same concept or construct. The internal consistency is here in the subcategory of reliability. And internal consistency means that multiple parameters or indicators used to judge an animal's well-being should provide a congruent and unified picture of its health, behavior, and the overall state, for example, for quality of life. Assessing the welfare of laboratory animals, researchers might look at different indicators, for example, the physical health by frequency of disease or body conditions, behavior, expressions, natural behavior, or signs of distress, signs of anxiety, depression or so, and psychological parameters. Stress hormone level is one point. And if these indicators are internally consistent, they should all point toward a similar conclusion about the animal welfare. And the last point, and I think it's one of my favorite points, is the responsiveness of the instrument. Responsiveness goes an instrument's ability to detect changes over a defined time period in the construct being measured. For example, the differences of pain levels. It's especially vital for tools meant to measure outcomes after intervention. And one intervention could be an analgesic treatment because the animal is in pain. And it's essential for every tool to assess quality of life of animals or other subdomains of this domain. It's essential for tools to be sensitive enough to pick up and both subtle and significant shift in well-being, allowing for timely action and adjustment in care or environment. Examples could be here analgesic treatment or give some diets on the ground of the cage or so. If a particular intervention, such as enrichment activity or analgesic treatment, is introduced to improve the well-being of animals, a responsive measurement tool should be able to capture any, and this is very important here, positive or negative changes in animals' welfare. It is failed to detect these changes. The effectiveness or responsiveness of this tool is low, and the effectiveness or potential harm of the intervention might be overlooked. And I think we have this problem in biomedical research, but also in context of farm animals. Responsiveness of assessment tools play a critical role in monitoring, in refining, and optimizing strategies aimed at enhancing animal welfare in general. This was a brief introduction about the Cosman framework, the factors of Cosman framework integrating in animal welfare measurement instruments, and if you give you here some further directions, some examples in the development and assessment of published instruments for quality of life in animals. One of the more pressing challenges in the realm of preclinical research has been the heterogeneity of assessment tools across the studies. Adoption of the Cosman framework can set the stage for a more uniform, standardized system for instruments, for a better compare, and metrics that will facilitate meta-analysis and systematic review, as well as improve instrument development in the next step. And here are some examples from the last, 2 years. Here is a systematic review about outcome measures for canine orthopedic care. Here, these authors created a systematic review and assess the outcome measures in this context with a Cosmin framework identify 6 instruments and described the characteristic of these measurements instruments in related to the Cosmin framework. Other example here is the measurement properties of pain scoring instruments, especially here in farm animals. We have a huge field of farm animals, and here it's very important to detect pain or stress and so in animals. And here's also very interesting systematic review using the Cosmin checklist. And the third example here is a systematic review about a Grimm's scale for pain assessment. And I give you some here examples from this study. It's very detailed, the implementation of the Cosmin framework to assess a well-published measurement instruments here, the Grimm's scale. But first, we have 2 different questions. One question is, does Grimm's scale have interspecies validity? Interspecies or intercultural validity. Intercultural is the original term in Cosmin framework. Interspecies validity is the adapted term from my side, but Grimm's scale have no interspecies validity because the animals or humans have a different anatomy, different behavior pattern, and so on. And 19 instruments published in 16 different species at the moment available. The answer of the question is no, we have no interspecies validity. We need species-specific Grimm's scales. The other one is, does Grimm's scale have content validity for pain? And you can see here, we are grimacing some emotional states, but animals, here an example, the mice, express emotional states also with grimacing, and this could be misinterpreted as pain. The problem for pain, for anxiety, for depression, or for the domain quality of life, the term is very, very hard to define and very hard to find. I think for my, it's impossible to find a valid measurement instrument with a good content validity for pain or for anxiety, depression, or for quality of life. We have maybe a good parameter, but I think we have no 100% content validity for these states. And this review, I think 15 instruments in 19 species. Here's detailed information about the mouse and the rat Grimm's scale. And we see here the different psychometric characteristics, validity, responsiveness, very important here, responsiveness. The Grimm's scale have a responsive against opioids, NSAIDs, or other analgesic drugs. We have a very good reliability with the inter-rater coefficient. Here, for example, 0.9, here 0.9, but also we see that we have very poor inter-rater reliability, but here in this study we have no training, and this is the point for Grimm's scale. We need good trained observer to enhance the measurement performance of the Grimm's scale. And for each of this instrument in each of the species exists here this table with these different parameters. I recommend this study. It's very, very interesting and very, very detailed. Further directions, I think we need to integrate Cosmin framework into the assessment of published and established measurement instruments for OBSRO and ClinRO, and from my side, we must integrate the Cosmin framework into the development of novel tools to reach higher quality instruments in the future. And this is my vision for the future. We have 2 different sides. We have one side here is the checking of published instruments by systematic literature search, combined with the Cosmin framework, with the Cosmin assessment of these measurement of these instruments, and then we can evaluate the instrument by feasibility and so on, and we can formulate recommendation. For example, for Grimm's scale, we have a poor reliability with untrained observers, and here the formulated recommendation could be that we need trained observer. We must train the observer to detect the different Grimm scales. And on the other side, we can use the Cosman framework in the development of novel instruments, based on extract behavioral correlates. At the moment, some initiatives create home cage monitoring, video-based home cage monitoring of mice and rats under different experimental conditions, analyzed by machine learning, artificial intelligence. And these extractive behavioral correlates could be a basis for a Delphi process. A Delphi process is an expert consent process. In this process, experts could say, okay, this behavior correlates is a surrogate marker, for example, for pain or for grooming or for well-being and so. And based on this Delphi process, we could here develop instrument related to the Cosman guidelines to have better instruments in the future. This brings me to my conclusion. The trajectories of psychometric approaches in animal quality of life assessment has illuminated an imperative for robust, standardized, and nuanced instruments, integrating Cosman standard or other frameworks from human healthcare science could introduce heightened reliability, validity, and, from my point, is very important, responsiveness, setting a benchmark for future measurement tools for quality of life in animals. But the journey is punctuated with many challenges, huge challenges, and I think some impossible challenges, ensuring species-specific relevance and fostering consistent researcher training. I think it's one big challenge in this development. I thank you for your attention, and I'm looking forward for questions or discussion about the combination of human healthcare science framework in development and assessment of tools for quality of life in animals. Thank you very much.
Thank you very much, Daniel, for this very interesting and enlightening presentation, and making this interesting bridge between animal and humans. Very nice. Maybe I start with the first one here. I believe one of the words you mentioned most often, and I fully agree with it, is the importance of training. That we need to have this training of researchers on how to handle animals, how to apply kind of a standardized scaling system. How do you envision such a training? Should that be practical, online? What would be your idea how to best do that?
I think the training could be on videos. At the moment, in my own research, we produce tons of videos from home cage with home cage system or in home cage situation. I think this could be a good basic for trained observer, trained researcher, and veterinarians. But I think we need measurement instrument, and we see this in the human situation. We need measurement instruments. We need simple measurement instruments. For example, a yes or no question, not a scale from, for example, Grimm scale 0 to 3. It's nice, no problem. But it's better we have a binary answer, yes or no. I think this is better than we need training. But I think we put much more effort in the development of novel instruments basic on yes and no answers.
Maybe in this context, actually, the question from Dimitri Lindenwald fits. He asks whether there is any progress on AI-based face grimace observation and recognition in animals.
Yeah. Yes, for example, in Berlin, in the 3R Center, they have a very nice experience on this approach. The problem is with the artificial intelligence systems. In the human, we have the problem, or as physicians, we have the problem that the decision of the artificial intelligence cannot guide or cannot stay alone than in context of the healthcare professionals and so. And from my side, artificial intelligence driven tools can only support decision tools, not decision tools alone. This is the problem. But I know we have many animals in the animal facility, and this is a problem for personnel, and time is very time consuming and personal consuming to track the animals each day. With the AI, we have a system, we can track animals 24 hours, 7-day a week. And the vision is we track these animals in a home care situation, and the researcher or the veterinarian have an app on the handy, and the app say, okay, animal 2 have a problem with the well-being. Look at the animal. But the decision for example, analgesic must be in the hands of the professional researcher also. I can say this concept of Cosmin framework integrating in animal welfare, I hope in the next year, in January or February, we publish here a review to make clear concept or the integration of this Cosmin framework into animal welfare science. For your interest.
Thanks. We're very much looking forward to that.
So the question in the chat is, what do you think about stress hormone measurements to assess welfare? The problem is with stress hormones, it's a good biomarker, but the problem with this biomarker is very, we have some problems, for example, for variability. We have a study, we created a study last year with familiarization of animals with experimental to handling the animals. But we see in the stress hormones in different levels, we see no fluctuation of the stress hormones. But we have handled this animals, we have familiarization. And stress hormones in this context is not a good measurement instrument. And we need here invasive. Well, we need a blood sample or so. This is sometimes this is a problem. Invasive method. It's good, but it's very dependent on the situation. That is the problem of the most measurement instruments. The very important to validate the context in which this measurement it's taken. Is a problem sometimes. The context.
Okay, thank you very much.
You're welcome.
I believe then we will close the webinar at this point. Thank you all for your participation. And with that, I wish you all a wonderful evening and see you in September again in this webinar series. Bye.
Goodbye.